Hello and welcome. Today we're diving deep into a kidney disease called analgesic nephropathy. This condition is a result of long-term, excessive use of pain relievers and can have serious consequences for kidney function. Join us as we explore its causes, effects, and what can be done to manage it. The primary culprit behind analgesic nephropathy is, as the name suggests, the overuse of analgesics, or pain relievers. While many over-the-counter and prescription pain medications are generally safe when used as directed, chronic, excessive consumption, especially of combination analgesics containing multiple active ingredients like aspirin, acetaminophen, and caffeine or codeine, is strongly linked to the development of this disease. This often occurs in individuals who are self-medicating for chronic pain conditions like headaches, arthritis, or back pain, leading to a cycle of increasing dosage and prolonged exposure. Let's break down what's happening inside the kidneys. The harmful effects of analgesics primarily target the renal papillae, the innermost part of the kidney. These medications, particularly phenacetin, are now largely discontinued but historically significant, and to a lesser extent, acetaminophen, undergo metabolism in the kidney. This process generates toxic metabolites that damage the cells lining the tubules and blood vessels in the papillae. Over time, this damage leads to papillary necrosis, where the tissue of the papillae dies. The kidneys then struggle to filter waste effectively, leading to chronic kidney disease. The damage can also lead to scarring, impaired blood flow within the kidneys, and reduced kidney function. Analgesic nephropathy was more prevalent in the past, particularly when phenacetin containing analgesics were widely available. While the incidence has decreased in countries where phenacetin has been banned or restricted, it still occurs, especially in populations with chronic pain conditions and access to over-the-counter combination analgesics. Certain demographics, such as women and individuals with a history of mental health issues or substance abuse, may be at a higher risk. The exact numbers are difficult to pinpoint, as many cases may go undiagnosed or be attributed to other causes of kidney disease. The signs and symptoms of analgesic nephropathy can be subtle in the early stages. Individuals may experience chronic dull headaches, fatigue, and generalized weakness. As the condition progresses, more noticeable symptoms can emerge, including frequent urinary tract infections, high blood pressure, anemia, and blood in the urine hematuria. Later stages can manifest with symptoms of chronic kidney disease, such as swelling in the ankles and feet, edema, nausea, loss of appetite, and changes in urine output. Diagnosing analgesic nephropathy can be challenging, as the symptoms often overlap with other kidney conditions. A detailed medical history, including a thorough review of analgesic use, is crucial. Doctors will typically order blood and urine tests to assess kidney function, looking for elevated creatinine and blood urea nitrogen (BUN) levels, as well as abnormalities in the urine. Imaging studies, such as ultrasound or CT scans, may be performed to visualize the kidneys and identify structural abnormalities like papillary necrosis. In some cases, a kidney biopsy may be necessary to confirm the diagnosis and assess the extent of kidney damage. While there aren't distinct types of analgesic nephropathy in the traditional sense, the severity of the condition can be classified based on the stage of chronic kidney disease. These stages range from mild kidney damage with normal or near normal function to end-stage renal disease requiring dialysis or kidney transplantation. The classification helps guide treatment and management strategies. The cornerstone of treatment is to immediately stop the use of analgesics that are causing the problem. This is often the most difficult step, as individuals may be reliant on these medications for pain relief. Pain management strategies, such as alternative therapies, physical therapy, or non-addictive pain medications, should be explored under medical supervision. Other treatments focus on managing the complications of kidney disease, such as high blood pressure, anemia, and fluid retention. In advanced cases, dialysis or kidney transplantation may be necessary. The best way to prevent analgesic nephropathy is to use analgesics responsibly and under the guidance of a healthcare professional. Avoid long-term, excessive use of pain relievers, especially combination products. If you have chronic pain, work with your doctor to develop a comprehensive pain management plan that minimizes reliance on medication. Regular check-ups and monitoring of kidney function are also essential, especially for individuals at higher risk. The prognosis for analgesic nephropathy depends on the extent of kidney damage at the time of diagnosis and how promptly analgesic use is discontinued. Early diagnosis and cessation of analgesic use can slow or even halt the progression of kidney disease. However, if kidney damage is severe, the prognosis may be less favorable, potentially leading to end-stage renal disease. Recent research focuses on developing new therapies to protect the kidneys from further damage and improve the outcomes for individuals with chronic kidney disease. Studies are also investigating the genetic factors that may predispose some individuals to analgesic nephropathy. Thank you for joining us, and remember to prioritize your kidney health.